Your doctor might be sending you in for tests you don't actually need, and some of them could be doing you more harm than good. That's not a conspiracy theory. That's what the American Board of Internal Medicine's Choosing Wisely campaign has been trying to tell us for over a decade. Tens of billions of dollars are spent every year on medical screenings and checkups that leading physicians now openly say are unnecessary, and in some cases, genuinely risky for people over 65. And the problem is, most patients have no idea. You sit down in that exam room, your doctor orders a test, and you just assume it's all part of taking care of yourself. Of course you do. You're being responsible. You're being proactive. But here's the thing. Being proactive about your health doesn't always mean doing more. Sometimes, especially as we get older, it means doing smarter. So today, we're going through 5 specific medical checkups and screenings that many doctors and leading health organizations now say are overused, overprescribed, or just flat out not worth it for most people over 65. We'll talk about why these tests became so popular in the first place, what the actual research says, and, most importantly, what you should be doing instead to genuinely protect your health, because your time, your money, and your peace of mind matter. Let's start with one of the most common and honestly most misunderstood tests out there. Annual full-body CT scans, sometimes marketed as executive physicals or wellness scans, have become a booming industry. Walk-in imaging centers have popped up all over the country offering these scans to anyone willing to pay, no prescription required. The pitch sounds incredible. One scan, head to toe, catch anything before it becomes a problem. Who wouldn't want that? The problem is that your body, especially after 65, is full of what doctors call incidentalomas. That's a real medical term, and it describes exactly what it sounds like. Incidental findings that show up on scans that are completely harmless but look alarming on paper. A tiny shadow on your liver, a small cyst on your kidney, a nodule on your thyroid. Statistically, the majority of these findings are benign, meaning they will never hurt you, never grow into anything serious, and never require treatment. But once they're on your chart, the medical system has to respond to them. That response means more tests, more scans, sometimes biopsies. And here's where it gets genuinely dangerous. Biopsies and invasive follow-up procedures carry their own real risks, including infection, bleeding, and complications from anesthesia. So you went in healthy, found something that was never going to cause you a problem, and now you're going through a procedure that could actually hurt you. This is called cascade medicine, and it's one of the most underreported issues in healthcare today. The radiation exposure from a full-body CT is also not trivial. A single scan exposes you to roughly 20 millisieverts of radiation. That's equivalent to about 200 chest X-rays. If you're doing this annually, that exposure stacks up over time, and radiation itself is a known carcinogen. So the very test supposed to look for cancer is slightly raising your cancer risk with every round. Major medical organizations, including the American Cancer Society, the U.S. Preventive Services Task Force, and the American College of Radiology, do not recommend full-body CT scans as a routine screening tool for people without specific symptoms or known risk factors. The science simply doesn't support the idea that routine scanning in asymptomatic, average-risk individuals saves lives. In fact, the evidence suggests it causes more harm than good for most people. Now, this is different from targeted, physician-ordered imaging for specific concerns. If you have symptoms, a history of cancer, or a doctor who has a specific clinical reason to look somewhere, that's a completely different conversation. What we're talking about here is the routine, let's just check everything scan that feels thorough, but statistically doesn't deliver on its promise. Here's another one that surprises a lot of people. Annual EKGs, electrocardiograms, for healthy adults without any heart symptoms. An EKG is a simple, painless test that records the electrical activity of your heart. It's fast, it's cheap, and it feels like something you should do every year after 65, right? Your heart is the most important muscle in your body. Shouldn't you be checking it constantly? The American College of Cardiology and the U.S. Preventive Services Task Force say no, not as a routine annual screen anyway. And here's the science behind that. For a screening test to be worth doing, it needs to meet two criteria. First, it needs to detect a condition reliably and early. Second, that early detection needs to lead to better outcomes. Annual EKGs for asymptomatic low to moderate risk, people fail on both counts. The heart is an electrical system, and its readings can vary naturally from day to day. Routine EKGs in healthy people frequently turn up minor abnormalities that aren't clinically meaningful, but again, those abnormalities have to be followed up. More tests, more anxiety, more medical bills. Studies have found that screening EKGs in asymptomatic patients don't reduce heart attacks, don't reduce cardiovascular mortality, and don't meaningfully change treatment outcomes. What they do is generate false positives and unnecessary downstream testing at a remarkable rate. If you have symptoms, chest pain, shortness of breath, palpitations, dizziness, absolutely get an EKG. If you have a diagnosed heart condition and your cardiologist wants to monitor it, that's medically indicated. But an annual EKG just to check for someone who is otherwise feeling fine and has no significant risk factors? The research doesn't back it up as a worthwhile routine practice. Now let's talk about something that's going to feel counterintuitive, because we've all been told since we were young that you should get a checkup every single year, no exceptions. But for adults over 65 who are generally healthy, the evidence behind the routine annual physical, as traditionally structured, is surprisingly weak. A landmark study published in the BMJ analyzed decades of research on routine annual health checks for adults and found that general health checks did not significantly reduce overall mortality or morbidity. That means they didn't meaningfully lower death rates or the burden of disease in healthy adults. Now, that's not a reason to never see your doctor. Please, keep seeing your doctor. But what it does mean is that the rigid, annual, full check with every possible blood test model isn't delivering the results we've always assumed it was. Part of the issue is that many routine blood panels include tests that have very poor positive predictive value in asymptomatic people. When you test enough things on enough people, you will find something abnormal just by statistical chance. Normal ranges in medicine are often defined as the range that covers 95% of healthy people, meaning that 5% of perfectly healthy people will have results outside the normal range on any given test. Multiply that across 20 different tests in a single blood panel, and the odds of at least one abnormal result in a completely healthy person get surprisingly high. So what should you do instead of abandoning medical care entirely? Work with your doctor to build a personalized, evidence-based schedule of preventive care based on your specific risk factors, your family history, your lifestyle, and your symptoms. For most people over 65, that still includes regular visits, just not necessarily every single thing, every single year, with every possible test thrown at the wall. The visits that genuinely matter at this age include blood pressure monitoring, cholesterol checks at appropriate intervals, blood sugar management, if you have risk factors for diabetes, vision and hearing assessments, fall risk evaluation, medication reviews, and cancer screenings that are age-appropriate and individually indicated. That's a meaningful, purposeful healthcare relationship. And it's very different from a reflexive annual panel that generates more paperwork than protection. One of the most controversial areas in this conversation is cancer screening in older adults, and specifically, when to stop. The PSA test, prostate-specific antigen, has been heavily debated in medicine for years. The U.S. Preventive Services Task Force recommends that for men 70 and older, routine PSA screening should generally stop. Not because prostate cancer isn't real or serious, but because prostate cancer in older men is typically very slow-growing. The data shows that many men over 70 who have low-grade prostate cancer will die of something else entirely before the cancer ever causes them a problem. But if that cancer is detected through PSA screening, the cascade of follow-up testing, biopsies, and potential treatment, which can include surgery, radiation, and hormone therapy, all of which carry serious side effects, may cause far more harm than the cancer itself would have. This is a concept called overdiagnosis, and it's one of the most important and underappreciated problems in modern medicine. Overdiagnosis means finding and treating a disease that would never have harmed the patient if left undetected. The treatment isn't harmless. It can cause incontinence, erectile dysfunction, fatigue, bone loss, and a dramatically reduced quality of life. So the question your doctor should be asking isn't just, do you have this? But if we find it, will treating it actually make your life better? Similarly, colonoscopy guidelines now support stopping routine colorectal cancer screening at age 75 for average-risk individuals who have had prior negative screenings. The rationale is the same. The benefit of detecting slow-growing cancer in a 76-year-old who has no symptoms and has had prior clean colonoscopies is outweighed by the risks of bowel prep, sedation, and potential complications from the procedure itself. This is nuanced, and it's deeply individual. Your doctor knows your history, your overall health, and your risk factors. These aren't blanket rules to apply without conversation. But understanding that more screening is not always better, and that stopping certain screenings at the right age is actually evidence-based medicine, not neglect, is empowering information. The fifth area where money is commonly wasted is what's called DEXA scanning for bone density in people who are already being treated for osteoporosis. DEXA scans, dual energy X-ray absorptiometry, measure bone mineral density and are genuinely useful for initially diagnosing osteoporosis and assessing fracture risk. There's no argument there. But here's where overtesting creeps in. Many patients who are already on medication for osteoporosis continue to get annual DEXA scans, and the clinical evidence shows this adds little value once treatment is underway. Bone density changes slowly. We're talking about changes of 1 to 3% per year at most. Measuring it annually creates a level of noise in the data that makes the results difficult to interpret meaningfully. The National Osteoporosis Foundation and major geriatric medicine organizations recommend that once a patient is stable on treatment, repeat DEXA scanning every 1 to 2 years is more than sufficient, and in some stable patients, even less frequently. What's happening in practice, though, is that many patients are getting scanned every year, sometimes at the insistence of a provider who is being overly cautious, sometimes at the patient's own request because they want to know how their bones are doing. The result is unnecessary radiation exposure, unnecessary healthcare costs, and, perhaps most insidiously, unnecessary anxiety when minor fluctuations in bone density scores get treated as emergencies. Now let's get into what you can actually do. Practical, evidence-based habits that genuinely protect your health after 65 without overtesting or overspending. The single most impactful thing you can do for your bones, your heart, your brain, and your longevity is move your body consistently and in specific ways. Resistance training, lifting weights, using resistance bands, Doing bodyweight exercises like squats and push-ups directly stimulates bone formation and slows bone loss in a way that no medication can fully replicate. 30 minutes of resistance training 2 to 3 times per week has been shown in multiple large studies to significantly reduce fracture risk in older adults. You don't need a gym membership. A set of resistance bands and a few square feet of floor space in your living room is enough to get started. Balance training is equally important, and it's something almost nobody talks about. Falls are one of the leading causes of death and disability in adults over 65. Not disease, not cancer, falls. Simple daily balance exercises like standing on one foot for 10 to 30 seconds, walking heel to toe in a straight line, or practicing Tai Chi can dramatically reduce fall risk. A 2019 study in the British Medical Journal found that exercise programs targeting balance and strength reduced fall rates by 23% in older adults. That's a bigger effect than most pharmaceutical interventions for the same outcome. Another genuinely protective habit is aggressive blood pressure management, and this doesn't always mean medication. Many people can meaningfully lower their blood pressure through dietary changes alone. The DASH diet, which emphasizes vegetables, fruits, whole grains, lean protein, and low sodium, has been shown in clinical trials to lower systolic blood pressure by 8 to 14 points. That's comparable to the effect of a first-line blood pressure medication. Reducing sodium to under 1,500 milligrams per day, cutting back on alcohol, and managing stress through daily relaxation practices like slow breathing or meditation all have real, measurable effects on cardiovascular health. Sleep is another area where the evidence is overwhelming and the habit is easy to overlook. Chronic poor sleep in adults over 65 is strongly linked to increased risk of heart disease, cognitive decline, diabetes, and depression. The goal is 7 to 8 hours of quality sleep per night. Practical steps to improve sleep quality include keeping a consistent bedtime even on weekends, keeping your bedroom cool and dark, avoiding screens for at least an hour before bed, and avoiding caffeine after noon. These aren't suggestions. The research behind them is robust. On the nutrition front, protein intake becomes critically important as we age. After 65, your body becomes less efficient at using dietary protein to maintain and repair muscle tissue, a process called anabolic resistance. Most older adults need more protein than they're currently eating, not less. Aim for at least 1.2 to 1.6 grams of protein per kilogram of body weight per day, spread across your meals. Eggs, Greek yogurt, cottage cheese, fish, chicken, legumes, these are your allies. Muscle loss, or sarcopenia, is one of the most significant drivers of frailty, falls, and poor health outcomes in older adults, and adequate protein is your primary nutritional defense against it. And finally, cognitive engagement. Your brain is an organ, and like all organs, it responds to how you use it. Learning new skills, reading challenging material, engaging in social connection, playing an instrument, taking a class. All of these have been shown to support cognitive reserve and reduce dementia risk. Social isolation, on the other hand, is one of the strongest predictors of accelerated cognitive decline. If you live alone or have limited social contact, making even 1 or 2 intentional social connections per week, whether in person, by phone, or even through a class or community group, has measurable protective effects. Now, a couple of common myths that are worth addressing directly, because they drive a lot of unnecessary testing and anxiety. One myth is that a perfectly normal set of annual test results means you're healthy and don't need to change anything. This is backwards. Many of the most significant health risks, including cardiovascular disease, insulin resistance, sarcopenia, and cognitive decline, develop slowly over years and aren't well captured by standard annual blood work until they're already advanced. You can have completely normal cholesterol and still be accumulating dangerous arterial plaque. You can have a normal fasting glucose and already have significant insulin resistance. The tests we rely on most heavily are lagging indicators, not leading ones. The most powerful health tools available to you are preventive behaviors, not reassuring numbers on a lab report. Another myth is that more expensive testing means better care. The rise of direct pay concierge wellness programs has made it easy to spend thousands of dollars on comprehensive panels, genetic tests, advanced imaging, and biomarker assessments that sound cutting edge and feel thorough. Some of these have genuine value. Many do not, at least not for the average healthy adult over 65. Spending $2,000 on a full-body scan and a panel of 50 biomarkers doesn't necessarily protect your health better than spending that same money on a gym membership, quality food, and regular visits to a primary care physician who actually knows you. And finally, the myth that stopping a screening is the same as giving up on your health. It is not. Evidence-based medicine sometimes says, "We've done enough testing in this area. Let's focus resources where they'll actually make a difference." That's not nihilism. That's precision. Following those guidelines, even when it means doing less, is a sign of a sophisticated, trusting relationship with good medical evidence and a good physician. Everything we've talked about today is general information based on current medical evidence and guidelines, but you are not a statistic. You're a specific person with a specific history, specific risk factors, and a specific body. The right screening schedule for you needs to come from a real conversation with your doctor. Ideally, a primary care physician who knows you well and can weigh the benefits and risks of any test in the context of your individual situation. If you feel like you're being pushed toward tests you don't understand, ask why. Ask what will change in your care depending on the result. Ask what happens if you don't do it. Good doctors welcome those questions, and if yours doesn't, that's information worth having too. Please don't use this video as a reason to avoid medical care or skip something your physician specifically recommended for you. Use it as a starting point for a better, more informed conversation. If this opened your eyes to how healthcare works and how you can advocate for yourself within it, hit that like button because it genuinely helps more people find this information. Subscribe if you haven't already, because we go deep on evidence-based health every single week. No fluff, no fear-mongering, just real science translated into things you can actually use. And drop a comment below. I want to know, has your doctor ever ordered a test that you later found out wasn't really necessary? What happened? Those stories matter, and the community here learns from each other. Next week, we're talking about the 5 supplements that research now shows are actually worth taking after 65, and the 3 that most people are wasting money on. You're not going to want to miss that one.